Welcome back. In this video, we'll explain the mechanism of the different types of oral contraceptive pills. The first on our list is the GnRH analogues. These medications mimic the action of the hormone GnRH. Normally, this hormone stimulates the release of other sex hormones and promotes pregnancy. This is only done, however, if the hormone is released in a pulsatile fashion. But when we take the medication as pills, we release it as a continuous fashion. And this causes downregulation of the receptors and pretty much causing the opposite effect. So the patient ends up having less FSH and less LH. Other than using this medication to prevent pregnancy, we also use it to delay puberty in patients who have early puberty. It can also be used with endometriosis and uterine fibroids. And if we take the medication in a pulsatile fashion, it will also promote pregnancy in patients suffering from infertility. The downside, of course, is hypogonadism and erectile dysfunction in males and decreased libido in females. Next on our list are the estrogen products. These are mainly used to treat hypogonadism and ovarian failure. And they can also be used later on to control the symptoms of postmenopause. So it's basically used to control the menstrual cycle. Of course, estrogen promotes the buildup of cells in the uterus. So as there are more and more cells dividing and multiplying in the endometrium, there's an increased chance of endometrial cancer. This chance can be diminished by taking progesterone along with estrogen. If a pregnant patient takes estrogen products, there's an increased chance of developing vaginal clear cell carcinoma in the fetus. And there's also an increased chance of hypercoagulability with formation of thrombi and clots. And it makes sense because in the last stage of pregnancy, estrogen will be very high. And when a patient takes estrogen products, the estrogen level will also be very high, and this will mimic the sensation or the physiology of pregnancy. Later in pregnancy, the hypercoagulability state is needed to prevent more bleeding after the birth. And so these patients will have pretty much similar effects. Another thing that would also cause hypercoagulability is smoking. So if somebody is smoking, they should not take estrogen products. And of course, we know that estrogen also causes breast cancer in susceptible patients. Next, we have the progesterone derivatives. These medications act exactly like progesterone, and they cause the thickening of the mucus and the cervix, which prevents the sperms from entering the uterus. And they will also cause decreased growth and multiplication process within the uterus. These are the most commonly used type of contraception, and they can be used as progesterone pills, or progesterone skin patches, or intrauterine device covered with progesterone, or progesterone implants. Other than contraception, they're also used to control abnormal uterine bleed and to perform the progesterone challenge, which is basically giving the patient progesterone for multiple days and then stopping the progesterone abruptly. And this should cause a lot of bleeding in a normal patient. If the sudden cessation of progesterone does not cause bleeding, we know that the patient has an anatomical uterine defect, like we see in Asherman syndrome. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helps.